Oh my goodness, wow. We are on for episode 12 of this awesome journey down hope, power, and healthcare. Chris Hemphill coming from Modular Feedback and
Melissa Reilly with Stealth Consulting.
cool. It's so good to be on this journey with you and go day by day exploring some of these issues in healthcare, but not doing drive-by hot takes or anything. Like I just wanted to shout out to Dr. Jessica Jackson. She's with Mental Health America and the American Psychological Association, and she actually talked about sharing the recent episode that was focused on the 10 commandments of provider healthcare sales. She actually is sharing that with her clients to let them know about, hey, you're going to this space. Here's the way that hospitals evaluate your mental health programs. And I just thought it was awesome to hear about the fam spreading the word about us.
Yeah, tell me a little bit more, Chris. What do you mean by no hot takes? I feel like sometimes you and I are like the hot take, aren't we?
I had some discussions about like, well, what truly is a hot take, and what the consensus came out to be in these conversations, because I'm like really wanting to avoid like being the people out there that are just pontificating on things we absolutely know nothing about, or going in and pretending to be experts in areas that we aren't. You've made it very clear. You said, hey, I'm not a clinician, but we'd love to have clinicians make these points on the show. When it comes to the policy discussions and things like that, we have our opinions. We have the way that the news hits us and everything like that. But the passion of mine for HPH, for our fam, is that that there's a transparent, we're going with transparent takes and then bringing in experts who can really go deep on some of these subjects.
Yeah, I love that. So we're like data informed and not just shooting from the hip in terms of like, this is how we feel that this should impact the world, right?
Exactly. And maybe our news comes out 3 days slower than whenever you've seen it on Twitter, but like that's the raw, and we're the more refined is what I'm hoping for.
We're the more filtered without gatekeeping ourselves.
But like, hey, one big example of that, UHG stuff, things that are related to the payer, to the big payer world. Those clips and episodes did really well because it wasn't a hot take. It was like a hot take developed in 15 seconds versus a very warm and informed take developed by 15 years of experience. So that's what we're hoping to bring to people's walks and jogs.
I love that. I love that. Well, Chris, where were you out in the world this week? How was your week?
In the world, I was in Detroit. So I was here, but I was down and dirty with clients in ad tech on the back-end database infrastructure and web crawling side, and on the in the insurtech space, in the health plan space, on dealing with the very messy provider directory data. So not the most glamorous AI headline type stuff, but I've been wearing my data janitorial outfit very well and just been enjoying learning these deep systems and processes across all these disparate systems, and just working to orchestrate that and make that stuff sing.
So you're elbows deep in data. Love that. Love that. I was out.
It's hitting me because like every week we're talking about like what's it like transitioning to this health plan space and everything like that. And the one thing, like, these are I've worked at companies that were usually around for 5-10 years prior, but this is a 40-year-old organization that I'm working for. And people talk about like these startups and innovators and things like that moving faster and things like that. That doesn't 100% have to be the case. So within the like there's the initial onboarding. I just want to just give some tips on getting started in these new roles. So you've got your onboarding, which will talk about like company values and things like that. But then it becomes a mission to do your Sherlock Holmes fact finding on who are your people within the organization. So been just doing a lot of interviews and conversations, and there are some people. So like I'm going to call out Corinne Strom, for example. She's the director of emerging technologies, and like we talk about the speed at which startups innovate, but it's about the people that are launching these systems and processes. She's just done so much to bring like really powerful emerging technologies to our space and help us move faster. So excited to that. Just wanted to give that bit of motivation for people that are working in these big institutions, is finding your people.
Yeah. Do you think a lot, I wonder how our fam feels about this. I just wonder, are a lot of our fam members starting new jobs, or are they bunkering down? That would be a fun little poll, right? Like, are you trying something new, or are you in it to win it for the long haul? And you're never leaving. I would love to kind of get that point of view.
Answer us on Spotify. The poll is out. Alyssa, our producer, just letting you know, you can put a poll up on Spotify, and let's find out: are you sticking with the big internal job? Are you working at an innovative startup? Are you looking to quit and start your own thing? What, like, we'll let's get that and then reflect that back once we get a sizable amount of people responding.
I love that. And I guess you could be in it to win it across all of these themes or all these areas, maybe. You know, more it's more what
It'll
I'm
just help
curious.
us know how to show up for how
Yeah.
our fam is showing up. So yeah, my week integrating to this new space, and I mentioned a little bit about ad tech, but I want to hear about yours.
Yeah, my week was great. I was in Nashville, getting together with a group of folks that I knew previously, talking about one of my favorite things. What are we going to do in the future to make the world a better
Mm-hmm.
place? And it was really fun. And
This is Nashville, so I keep hearing great things about Nashville. That I'm hearing from venture capitalists even that it's the new hotspot for healthcare innovations. Was this related to like some sort of bigger conversation, or was it like meeting up with
yeah,
healthcare
well,
friends?
it was actually a convenient location for people that are East and West Coast. But part of the
Ah,
reason we chose it is because um, Nashville really seems to be a place where you can get a lot of things done in healthcare. One of my friends that was at the meeting was talking about she's able to do 3 dinners a week with healthcare stakeholders pretty much consistently because there's so many people there doing good things in healthcare. I know one friend that also just moved there recently, and so actually two friends. So within the last year, have moved to Nashville. So yeah, I feel like it's a space I want to spend a lot more time in. Because right now I spend a lot of time heading to New York or trying to find the venture groups within Connecticut.
well, I can tell you some fun things about Nashville. Like maybe we'll talk about some at the end of the episode, because I wanted to talk about the silly and fun things that you can do in your local towns and encourage people to look that up. Nashville has some really cool stuff. I've spent about 10 years going back and forth there when I was living in Birmingham, Alabama. Lovely city. Uh, what was the hot talk on the healthcare scene for y'all's discussions?
Yeah, it was definitely the big beautiful bill.
Mm.
And how can we use the big beautiful bill as a way to help counteract some of the negative things that are definitively coming out of the bill? Um, Again, you all know I never try to be political. I'm pretty independent, but um, I don't like harm to our innovators in healthcare. And I see some elements of harm, Chris, that I just think we need to have some things in place. The number one place that I probably get the most frustrated over is maybe the redetermination piece beyond just the massive cuts in Medicaid funding that we'll see. Um,
I've had some conversations about redetermination, but can you expand on that one? Just
yeah.
the basic
So
definition.
um, please feel free, fam, to write over me because I was only a Medicaid compliance manager for 2 years, so I really only saw one Medicaid plan in Connecticut, and that means I only know one Medicaid plan, which is in Connecticut, which no longer exists anymore. But the process of redetermination is almost like a eligibility check to say, can you still have this coverage? And in order to be redetermined, the person has to validate through a certifier that they have the coverage needed. And the reason I'm being so vague is because different states have different redetermination requirements, and maybe we can post a couple of them or links to them. How does the redetermination process work after the show? But the whole idea is that someone could make a mistake in certifying, like forget to turn in one form or just miss a date, and then they could lose this coverage. And when they lose this coverage, then we have more people with uncompensated care. When we have uncompensated care, Chris, where do we go?
To the ED.
To the ED, right? And hospitals are not in a place to be able to take on all the people who are going to lose coverage, right? And so it was just sad. Even the article from CNN was like, here's who stands to win and lose with the big beautiful bill, or some people like to call it the big ugly bill. Hospitals.
We have to, like, in fairness, we have to alternate. 50% we say big beautiful, and the other 50% we have to say big ugly. Like that.
Yeah, I mean, it goes back to, like, some people are still like wildly confused that was actually a name of a bill. But yes, we can totally do that, Chris. And I just think hospitals are going to be one of the largest set of stakeholders that are upset by this bill. Rick Pollack, the CEO of the AHA, the American Hospital Association, has this amazing quote: real life consequences of these nearly $1 trillion in Medicaid cuts, the largest ever proposed by Congress, will result in irreparable harm to our healthcare system, reducing access for all Americans, and severely undermining the ability of hospitals and the health systems to care for our most vulnerable patients.
So go ahead.
I was going to say, there's a pro to that, right? I think other people will argue, well, no, we've set up a $50 billion fund to help rural hospitals contend with these Medicaid cuts. 50 billion, 1 trillion, just doesn't seem like enough is there.
Yeah. It's really an obfuscating argument if you cut by 1 trillion and say, but wait a minute, check out this 50 billion. Like you're in Las Vegas and the slot machine tells you, hey, you just won 20 cents when you spent like $3 or whatever. So yeah,
I know. Can you even imagine $1 trillion in cuts? I mean,
I can't.
Yeah,
literally can't. And that's like with Rick and others. I've been looking for the impact analysis. 1 trillion is such a gigantic, incomprehensible number. And I even made a LinkedIn post recently about, hey, has anybody done some impact analysis? And I'm starting to see some responses on that, but just trying to figure out where this freaking gigantic cookie crumbles.
Yeah. And I think part of it comes down to we're starting to lose a lens of investigation and interrogation on things. We were you and I were talking about this a little bit. Like, we prefer sound bites, and when there's so much packed into this bill, you really have to interrogate this bill. Like, pull out your notebook, LM, get into your chat GPT, like start to decompose. And that's a little bit about what our group was doing. We were like mapping, those mind maps to say, okay, if redetermination gets harder, we knew redetermination wasn't easy for managed care organizations when you only had to do it once a year. Now that you have to do it twice a year, what does that process look like? What does that mean? How can we make redetermination easier for people? Because it's really the lifeblood of how the managed care organizations keep their membership, which means that's how they get their payment, which means that's how people's care gets covered.
Yeah, and I'd urge the fam to check out the Trade-Offs podcast, which has a really deep episode called The Treacherous Transition Awaiting Millions Losing Their Medicaid. This was during the redetermination process that was launching in 2023.
The first time when we weren't ready for that. The first time.
Yes.
Yeah.
And it follows the fact that people move. It's hard to get in touch with people to re-verify their Medicaid status. And in the example, they interviewed someone who was impacted, who lost their Medicaid coverage, even though they fit the working requirement and things like that, because they thought they had submitted the paperwork correctly, didn't, and wasn't able to access the follow-up, and lost coverage even though they were doing everything right. Trade-offs, they always go, they're great to follow for overall policy, and then they always get specific on patient stories. It was a great episode.
Yeah.
We'll link it in the comments.
Yeah, Chris, I just think this is a topic we need to spend a lot more time on. And bring in some additional experts, because I think the impacts of this big ugly bill are going to be felt for a really long time. And I don't think we've even started to see the downstream impacts to individuals who are seeking care, needing care, and even some of these work requirements are going to be much more challenging for people to meet. And I don't know, I was a single mom once, and I had a job. It was at an insurance company. Um, if I told you what I made, $29,000 a year in my first job, I was close to, Medicaid eligible, and I was employed. You can't do very much on $29,000 a year. And I know some people are doing a lot more than I was on less than that.
That's tremendous here, and I think that part of it is we're talking about the issue today, but we're going to have to keep talking about it tomorrow and bring in some of these experts. One person that comes to mind, I don't know if she'll want to come and talk to us because I think that she's slowed down the work lately, but Mary Walter over at Health Management Associates, HMA. We actually did in a previous company podcast, we did an episode on Medicaid redetermination, and she was open about the fact that like she came to this country and she was on Medicaid for a time, but has now gone into the consulting world. And there's also another person from HMA, Letitia Reyes Nash. I don't know. I'll read. I encourage everybody to follow and see what they're saying, because their job is converting this policy concept into advising for clients across various aspects of healthcare. So let's follow these people, folks, and
Link the previous episode. Yeah, let's definitely do that. Because everything is old that it is new again, right?
Yes.
We're seeing this.
2023 is relevant.
Yeah, we're seeing this cycle, and so maybe there's things others can learn for those that want to go deeper in this space and start to explore some of these impacts. It could just be a really helpful view, because there's probably a space people weren't thinking about. Hey, we've got this solved, or it's getting better. It's going to get easier with the emergence of ChatGPT and new advances in data that are going to make these processes easier and faster. But I think confusion is that greatest chaos predictor of the status quo, right? And I think there's going to be a lot of confusion around enablement, who's losing money. So I left our session in Nashville actually super energized and jazzed, right? I think when there is bad things that happen in the world, there's an opportunity for good people to come together and do good things. And that's what I'm going to keep looking for.
Absolutely stunning. And it sounds like that meeting's not a one-off. How are y'all keeping in touch between?
Yeah, this group is going to keep trying to get together. We're going to try to set up some structures or maybe some companies to be able to counteract some of these things that we're seeing. And, I'll definitely let the fam know a little bit more as I can share and as things evolve. Right now it just felt like a gathering, a convening of great people, just like we try to do on the show, bring great people together and, talk about things that matter to us and try to do a little bit of good.
Thank you. Well, hey fam, stay with us, stick with us. Again, no hot takes here. We can't promise the moon in one episode, but we can keep you along as these as we find more pebbles and stones building up this road to wherever we're going.
Yeah, and really try to support you all, whether as we learn if you're staying, if you're going, the things that you're trying to do, all the hard things in healthcare, we want to help, and Chris, it might be a really fun time to talk about the article we saw around mental health screenings. I felt like that was something really interesting that you found that talks about good things and bad things, but there's some interesting nuggets in the data. Could you tee that up for the fam? And I just thinking of your Alabama roots. Alabama was a state that I really focused in on. So maybe we use Alabama as a use case. I looked at Connecticut for me and Alabama for you.
Let's absolutely focus in on that. Let's just say that this episode is brought to us by Dr. Jessica Jackson, because she's the one that put me on to what Mental Health America is doing. For those that are not aware, Mental Health America it's a small but mighty organization that I believe is nestled in DC and has been influencing policy and thought around mental health since 116 years ago. Mental Health Month, that is actually the product of Mental Health America
Really?
in
They created the
1949.
month?
Yes.
Tell me more.
This is an organization of no more than 50 people, 50 to 100 people, and they're a beacon of outsized impact. So they're just really good to follow. Look up Dr. Jessica Jackson. Look up the organization. I've seen Kelly Davis, who's their head of youth mental health. Follow her. Like she comes from a very real place in her conversations. Mental Health America, great place to follow. And Jessica, she also consults with startups, and she tells me that everybody she's telling about Mental Health America and the data they're collecting, we're talking 17,000 mental health screenings per day that they are doing. And then they're collating the data in a place that is free and available to access, yet nobody she talks to knows about it.
Yeah.
Myself
Well, that's
included.
wild.
Yes. So for folks trying to figure out and get a footing on where incidents are coming, they're testing for, I believe, 5 different criteria that are including probability of suicide, depression scores, past trauma, etc. They're screening for these things on a daily basis, and then monthly they're updating data on, again, we're talking 17,000 people per day, millions and millions of records that freely available for people to look at, understand, and localize all the way down to their region.
So I actually know a ton about mental health screenings because I have been helping this amazing company, Morrow Health, fantastic founder, Kenzie Batera Davis, do some work around mental health screenings through schools as the distribution centers. And so she can put through any type of screening the school wants, be it a GAD-7, PHQ-9, right? I don't know that we've talked about this, so I'll have to circle back to that with her even. I mean, she probably knows about it. We just haven't circled on it. But the interesting things around behavioral health screenings, Chris, that I've started to learn is just some states are wildly supportive of it and others are less so, right? Like Illinois is a fantastic state. It's very pro screenings. And actually, Governor Pritzker has a whole bill. And inside the bill, they actually incentivize mental health screenings.
So they're really good at collecting them over time and reporting back to us?
They're very good at encouraging screenings to happen. I can link to that bill as well. And so is it because they put so much energy into that bill that, helped their their state rise up higher on said list? But then if you go into the map, I clicked on Alabama, right, which is actually one of the states with kind of the worst scores as it relates to mental health, right? They were 40 on the list of screening. And so while I don't believe screenings are correlated to higher or lower mental health, I do see there's probably some causative data element that, if you start screening and you focus on it, after you screen, you're moving people into care. The byproduct of more screenings ultimately should be more help. And that's what I'm really pro.
Yeah, that would be interesting to examine. And honestly, we could talk to them about their methods and if there might be some kind of relationship. But it would occur to me that if a state is encouraging more intervention around mental health, then we should see some better outcomes. But would love to dig down with them and say, hey, what can we infer from this?
Yeah, nonetheless, we would love our fam to know that this data is out there. Chris, being the data wizard that you are, can the fam go download their data and leverage it? Or is it just kind of, you can look at it?
I don't know if you can download that particular data set, but they do make other data available for download. So it's a matter of following them by whatever means you can. They actually have a pretty big social media presence, but getting that thing bookmarked and knowing that since it's updated fairly regularly, you're checking on it once a month and seeing what new reports are out. They've released something like the State of Mental Health report as well. So it's something to keep an eye on and see where there are opportunities to download data sets that might be pertinent to your business.
Is there anything else you want to add on this, Chris, before we move on? Because that just sparked a total topic switch for me.
Let's topic switch.
You want a topic switch? Okay. So one of the things that I have found really interesting as I've gotten more tactical about data, because, I feel like I'm learning so much even from you. I would imagine that my skill sets sometimes pertain a little bit more towards the commercialization, but in working with you, I find like I get more tactical about like the how to do things. And I feel like that would be super valuable for other people that are kind of in this space, right? And so a lot of the projects that I do with many of the companies I work with is a lot around, hey, we need to shore up your evidence base, and so we should go buy some data, right? Or we should start to look at data that's going to help you make a better argument. Chris, you found some really interesting thought starters around like data purchasing and acquisition. So I thought I could turn it to you and ask you a few questions maybe on like, tell us how people buy data. How should they buy data? And do we have any other friends or, helpful hints for our fam who might be embarking on the same shore up the evidence journey?
Well, let's kick it off. I want to start by giving a shout out to Kevin Holland, who works for a company that I respect called Hallmusk that is very focused on making real world evidence available for mental health.
Oh, I know Hallmusk. Isn't that so funny? Cool. I ran into them like 5 years ago. Interesting. Yeah.
Great to have on the radar. Seeing them moving and shaking and doing some really interesting things. But what Kevin put out that caught my eye was this really detailed guide on what people should be thinking about if they're innovators that are building data products or buying data products. And the big takeaway. And I'm speaking to if you're an innovator who's building something that might involve helping like using a data source or helping helping other organizations easily access data that you're providing through APIs and things like that. It's a very powerful guide to read and understand. And the biggest takeaway that came from me is like I will be sometimes overly focused on quality and accuracy, but then forget about like there's a whole user experience for the people that are accessing the data and presenting on it, making decisions from it. And it was just that reminder that data doesn't exist in a silo. It's all about how you are empowered, like using it to empower the decisions for your end users. I thought that was a great takeaway from it.
Yeah, Chris, do you think most founders, get to the level of data that they should?
I think that there's a hard time with it. Because there's a lot of misnomers about data, and let's start with one: the data never lie. I believe that data is a very powerful tool, but you have to understand how it can lie to you and how it can deceive for you to really get to really get the value from it. So that results in an over-reliance and over-belief on what's coming out there, but there are a lot of sophisticated organizations that they'll say, okay, I see your rows and columns and spreadsheets, I see your tables connecting with each other, but there's some additional evaluation that we have to do on the other end. So I got a couple of tips for founders that are buying data sources, and hopefully that translates into tips for people that are creating data sources too.
All right, let's hit it. What's your number one tip?
The number one tip is tell me something that I already know. People think that tell me what I don't know is the most interesting thing, but you got to start with what I already know so I can validate your methods just from the rip.
Could I say that as like prove that your thing really does what it promises it's going to do? Yes. Or is that too far?
Prove your thing that does yes, 100%. Why would I want to make this purchase if I know it's inaccurate and I'm going to make bad decisions from it? So the way to do that is not to say, hey, can you report on the accuracy of your data? Because what's the salesperson going to say?
It's 100% accurate. I'm a salesperson.
So to get around that, you say, hey, here's a list of names. or here's a list of addresses, yada, yada, yada. Go into your data set and report back to me on what it's reporting for these addresses. You already know. You hold the cards in your hand. You know what the actual answers are. And your evaluation before you make any kind of purchase, they're going to be willing to do this if they want to make their commission to make and make the deal. So you have a way for them to blindly, like, all they have is the information you've provided, and then you can see if it matches against what you've already validated.
Yeah. So like, I heard a second tip in there, like really related to the purchasing of data, almost like test their data against your data before you make a large commitment to buy from said data vendor.
Yes, yeah, because let's say it like this: in the provider directory space, you're gonna estimate that you only have a 60% accuracy level. So what you're trying to determine is like the 100%. Like, tell them, once they say 100, say, I want to talk to your data scientist, because data scientists are afraid to ever say 100% anything. If I see 100% anything, I'm like, oh, what did I do wrong? What am I meant? Yeah.
So, it's a salesperson talking.
Yeah. Oh, 100? That turns me
You
off
are not a data scientist.
So you bring you see, like, okay, if they're X% accurate, then you kind of have that buy no buy decision. Maybe there's a little bit nestled in that advice too, which is when you're making data-driven decisions, it's not data-driven just because you looked at some data points. What truly makes a decision data-driven is if before you have even looked at the data, before you've conducted the analysis, you've identified some thresholds where there might be a buy no buy decision. So just putting that in practice, you might say, if we can return a data set that is 75% accurate from what they've sent us, then we buy. If we don't, then we don't buy. So you're making the decision data driven by saying, hey, here's the data point, here's the element that that we need to exceed or underseed. I just made that word up. If we want to go forward. So that's just a little tip on making truly data-driven decisions.
I love that. I'm going to back us up even a moment, right? For these early founders that are like out there thinking about the company they want to start, how do they know, Chris, where to go? There's no like Walmart for data out there. How do you know whose door to even knock on?
You've got to get out there and talk to your people. The people in your target audience, they're gonna have, like, you might have identified an issue in this space, and you're up against people with 20 years of experience, knowing the ins and outs, knowing how data entry people in these various fields really do what's going on. So it's gonna take learning on. Are there open data sets from CMS? Are there data providers? Like, what are the people in my market relying on? And when you start learning about what they rely on and what those ins and outs are, you can make better informed decisions. But it's about talking to them and understanding what goes wrong in the data sets that they're familiar with.
Yeah, I mean, a great point brings us back to our prior topic, right? With this Mental Health America, right? You know, like if MHA starts to collate this, majority of this screening data, right? Like a founder like a Kenzie would they knock on the door of Mental Health America? Would they, I'm not asking you to answer this question, but it's that kind of argument or that kind of interrogation of, who's holding data sets that are going to help these founders move a lot faster with a stronger evidence base, right? And a lot of times when you're in this brand new space, Chris, people haven't collected the data. That's part of the problem. So what do our founders do there?
Don't do it alone. You're new. You've got this problem. Don't gatekeep yourself just because you don't know all the data sets from day one. But do go on communities like Health Tech Nerds, where there are physician data scientists there. There are people who are obsessed with this stuff in this community. I don't know how many people are in it, but it's very active. And that's where I found that Kevin Holland piece that we're linking in the show. You go in there and you ask a question and you're going to get a lot of answers, a lot of responses. The name that I keep seeing so many times is Jim St. Clair. he's just an awesome person. Like I forget exactly what he's doing right now, but I know he's been involved in health information exchanges and things like that. Just awesome people within that community, and hopefully by the time we speak in our community on our Discord, where you can have some good conversations with people that are doing the same thing or have been there, done that.
Yeah, it's been easier, I think, in my point of view for the founders I've been working with to connect them to, some of the actuaries, but the data scientists, I think, are becoming an even more important part. And so, it would be awesome to start aggregating more data scientists together to be able to help some of our founders that are trying to do some really interesting things.
Cool. So you have opinions, thoughts on data within healthcare. Bring them to us. Talk to us, and yeah, we want to get the right people connected with the right problems.
Yeah, I don't think everyone is obsessed with like the data and the actual arguments in the same way that we are, Chris, but we can try to help groom people into that.
Yeah, we want to give them some of our excess excitement and let that spillover effect happen.
And some practical tips for like how to do it, because I think more so than ever, this data, it's like the next level currency that's really going to unlock value for these companies in a way that I don't think we were even able to like a year ago.
100%. And what you're seeing, there's all kinds of different ways that people are taking actions from data using artificial intelligence and things like that. But all the way down to the beginning, we know the phrase garbage in, garbage out. And that's easy enough to say. But you start talking to these communities and you start talking to the people in your audience, you understand, well, what is garbage? How do I identify that?
And yeah. Is it p-value? No. Give us one more tip, Chris, before we close off this topic. Like one more favorite tip for founders that are, maybe working with data for the first time or finding their data set. What would be next in importance?
The final tip is in healthcare, explainability trumps everything. If you have any kinds of results, like if you're building out, you've got your sophisticated model, you've got that API that says this person is this likely to need this particular service, the end users are going to want to know why. And there are approaches that you can take that are, that drive accuracy and predicted results and things like that, but they're not explainable and they don't get used. I've just been in these scenarios where, where the data science team had produced some model, but the hospital team was reluctant to use it. Not by no fault of their own. I don't like the idea that people go around shaming people for not using what's coming out of AI. I just think that if you're a skeptic, that just means you have deeper questions that need to be answered. So you need to understand what your audience defines as understanding something. Weird, big word, epistemology and everything like that. But if you're telling me a bunch of accuracy scores and metrics and things like that, but my alignment with truth is just like knowing knowing the ingredients of the model and things like that, you need to understand what they need to know about it to say, okay, I understand this and I believe this. So explainability is not just providing a spreadsheet, it's understanding your end user.
Yeah, let me give a real world example and then you tell me if I interpreted it in the right way. So when I was working for this really amazing company, Digital Diagnostics, one of the things we had to look at in order to be valid with our FDA trial was sensitivity and specificity, right? So our output had to come in at these certain sensitivity and specificity limits. When you would go talk to a health system or health plan about sensitivity and specificity, of the 10 people you might gather in the room, 2 might actually care about sensitivity and specificity, right? So
smaller, and that's from the small number who actually knows how to calculate that.
Right. And I'm not making fun of anyone, right?
Even a good data scientist might not know off the top of their head how to do that calculation.
So I would often find myself being like, the algorithm can tell you if you have diabetic retinopathy or not. And why do you care about this, right? Because this means you don't have to go through, taking a picture. You now don't have to do this whole other exam, and your clinician can be free to practice and do other things that are going to make them even more money than this one exam they were going to do for you, right? So that was like for half of the audience. for the other half of the audience, Chris, you had to like then go deep into the science and be like,
Mm-hmm.
we've run through X amount of exams and we test the algorithm in accordance to blah, blah, blah. Right. And so it was such an interesting, almost like context switching of the sale, to be able to like first start at that really high level of like, why should you care and why should the other people not care, the clinicians who you are now kind of replacing with this algorithm. And then for the scientists in the room, you had to make sure that as a salesperson or the founder, you could, sell your concept without boring them.
Yep. What a difficult way to have to read the room, right? So you have to be able, like it starts bringing in skills on how do I, because you only have 30, 45 minutes to present, and you want to hit that high level, the executive briefing overview, which you probably should like include your high level metrics like way in the beginning of the meeting so that the executive get their takeaway, and then go deeper, but still do it in a way that you've got good nuggets that people can translate and understand. Use analogies, like you delved into a personal story that was related to that overall point. You've got to bring in those personal stories and specifics to make those overall broad metrics you're presenting really stick.
Yeah, and I think that's a lot of work. I think that's a lot of work, and I don't think all the time the founders understand the importance of translating the data story. And so I think it's a really good tip, and I think others can benefit from really telling their story on both like the business side and the science side.
I'm gonna brag. Go listen for the fam. Go listen to the Health Further podcast. There's an episode, the most recent episode, that has Tarun Kapoor. So if you Google Health Further Tarun Kapoor and click the latest podcast episode, you'll get to hear him talk about it. And the brag here is that he actually reported a metric that I had given him 7 months ago back at Wobot. So in that, like I had explained, like how to discuss p-values, which is a measure of whether or not something is due to chance, and how to and I just gave him.
You told me the story before, Chris, and I had to go and look up p-values, right? And then I was
did
like,
I just lock myself into having to explain it again?
yes. No, you don't have to for me, because I then looked at p-values and I was like, oh, this is statistics. Oh, got it. And then it unlocked for me, right?
Thank you.
So stop and like explain p-values to the fam.
Okay. So in a lot of literature that you're reading, because like people say the science says, but how do you understand what the science is actually saying? A metric that a lot of studies rely on is this concept of a p-value, and taking away the technical terminology and all that. What people are trying to understand is, if I see a difference in these PHQ-9 scores, if I see a depression screening happened on March 1, then it happens on March 14, and there's a 6-point difference on average. What's the likelihood that that difference was just due to chance?
Versus being statistically significant and meaningful. Because if it's just due to chance, it's garbage, right? Like, or not garbage, it's like not as good as strong, right? Means the thing that you did had no impact on it, right?
Exactly. Yeah, that's going to impact their decision, because if what we're seeing is due to chance, then why do we need to implement the solution if the whole change was due to chance? That's something. You want to be up on that, because especially on the physician space, this is the statistics they're trained in. So a p-value helps in defining their definition of truth. The p-value itself, it's usually like, you'll see if it's above 5%, then all that's saying is that there's an above 5% probability that the score you're seeing, the difference you're seeing, was just something that was going to happen anyway, just something that was due to chance. So the idea is for that score to be as low as possible for to help aid people's certainty that they're just not seeing something that would have just happened randomly anyway without your intervention.
So low p-value, yeah, I think you got it. So low p-value means intervention good.
You can say, like, I'm going to allow, we don't have to go all super technical on it, but yeah, at the very highest, like what these researchers are proud of, in their papers, they're usually saying something like p under 5%. So Tarun, he explained it clearly, succinctly, but he already knew that concept. But the thing that was funny to me was he quoted this stat where he said that, and he said that the value shown on this, like it's usually like people are saying they're proud to get less than 0.05, but this one was many zeros and then a one in terms of that probability of due to chance. And the analogy that we had given when we talked about it, he used the same exact analogy, which was that's the equivalent to if you have a baseball stadium full of 50,000 people and they all flip a coin once and it lands on heads. That's that's the opposing probability that we were dealing with. So when he explained that, it just drove home the point to me is like you have to bring in some crazy, like just depending on what your data are saying, you have to bring in some way to like really make it stick and really like personify it, versus if I said, oh, the p-value was the power of 10 to the negative 34. That doesn't stick as well as baseball stadium with 50,000 people landing on heads all at the same time.
So I will tell you, just from like being out in the real world, I do think this level of diligence is happening. It's often happening in these clinical reviews. I don't know that we're always looking at p-values. Like I don't often hear p-value in the conversation, but maybe there are ways that we can help others, continue to make this concept so real, because in many of the conversations that I've had previously in the coaching, I don't know that we get to this level of data interrogation as much as we should. I would say, especially at these early stages, it feels like the companies aren't ready for that yet. But thinking about it early is just so important.
I'll say this. The conversations, like, we might not be in those conversations, but they are often happening on the back end. Because like if you're talking to 3 or 4 people at a provider or payer or what have you, you're really talking to 20 if there's a committee involved, and they're on the back end asking these questions, and you got to be prepared on all fronts. So you've got to have the nice slick deck that understands the overall impact of these systems, but then you have to have the papers out and the research, like not in every decision, but in a lot of decisions. That just makes the other conversations go back more smoothly. If you get a rejection from an organization, you likely don't know why it happened, but there could have been that conversation that was happening in the back end that was like, oh yeah, I looked at one of their papers and it just didn't.
The science isn't there.
Yeah.
I don't think the pull through is happening enough to the sales team on some of the clinical validity. And that also could be because in my world, I spent a ton of time in the mental health space where, value-based care is still, crystallizing in terms of outcomes and, opportunity. And so, thanks, Chris, for these great points. I think they're really helpful, and I think we'll keep helping others pull them through in different ways. And I can kind of see like a fun video explaining p-values and using this analogy of the baseball.
Look,
coin
Alyssa,
flip.
we've got a queue of like short videos that we need to make. I would love to make a p-value explainer for health innovators and purchasers
That aren't data scientists, because the data scientists don't need it.
Yes. So the other, well, actually, did you want to? I know we're a little bit long in the tooth here. Did you want to go to the Medicare topic or get moving along?
Yeah, maybe we tease the Medicare topic for our first time next week, because it kind of links back into our last one of our previous episodes when we talked about the role of prior authorization. And now we get wind that prior authorization is expanding in traditional Medicare. So why don't we start with that next time and we move into pop culture, Chris?
Okay. So alert on the Medicare Medicare expanding prior authorization. This is basically traditional Medicare kind of being molded to look a little bit more like Medicare Advantage. There are people that are doing impact analysis, and we'll link to that in the article, but we'll go in our comments, but we'll go deeper on that, because it's walking along a journey with us. Melissa, you started with talking about AHIP and its commitment to ease the prior authorization process. Then all of a sudden we see this talk coming out from CMS on how they might be expanding it. So let's keep walking on that journey and keep the fam informed about what's happening, what's being measured, and what you might be able to do to innovate in this space.
I love that. I love that.
Pop culture fun.
Okay, can I start? I have a great one.
I want to hear. Yeah. What's been moving you lately?
Okay, so my 12-year-old and I had movie night on Friday, and she got to, well, I sort of picked, but we watched it together. And it was The Life List on Netflix, which is an oldie but a goodie. I think it's like coming off Netflix, but it's this story of this mom. She was the CEO of this cosmetics company who fires her daughter upon her deathbed and then brings up this list that the daughter had made, like the no regrets list. And then her daughter has to execute each item on the list. And each time she executes one, it might be like go do stand-up comedy. It could be learn to play Claire de Lune. I'm like spoiling the whole movie. She gets a new video. And it just resonated with me because I just think we only have one life out here. And so, make sure that you're living it right, kind of to the point of, asking our fam, are you happy where you are? Are you considering a change? Are you, crossing off all the things you said you wanted to do? But also from this idea, like one of the spaces I've been looking at a lot, lately is like compassionate death, or how do we take care of people that are dying, hospital at home? And so, with this aging population, I think there's, more we need to think about in terms of like, how do you want to live your last couple of moments? Or if you get sick, what things are you going to put in place, whether it's medical interventions or just interventions to, keep your family living the best life they can. So I was like bawling at a couple of moments in the
movie sounds like a breath of fresh air.
It was very sweet. Very, very
Did it make
sweet.
you think about your list?
Yeah, but Chris, I'm living my list. So, one of them was create podcast, check, right? So, yeah, it made me feel really good and smile a lot that like we're getting to do the things that we want to do in this.
Well, I mean, there's the podcast is filling some other itches on my list too, because like all this music setup and everything like that, I'm not like going out and touring or anything like that. But I did get to have a lot of fun making that Taylor Swift mashup intro, digital underground hardcore music that we have on our podcast. So like, if you have these artistic ambitions and other things that you want to do, and maybe the path isn't like going the Hollywood route and or being a full-time artist, but maybe you can find other ways to like integrate that into your work and the other stuff that's already keeping you busy too.
Yeah, I love seeing all that for you. And I appreciate you helping me with like the podcast studio in the future too, Chris. And, hopefully I'll get like a real setup and everything just like you.
Well, very soon. We're moving fast, and I see good things in the next few freaking weeks.
Love it. What about you? What are you looking at for pop culture?
Pop culture, I want to know anything goofy that happens in your local towns and stuff like that. Last night, me and Shay, a partner, we went to a festival called Nicholas Uncaged. And it was a Nick Cage movie marathon in Detroit, held in like this big venue, and they had like Nicolas Cage themed drinks. We watched The Wicker Man and Next, and it was like, just really fun, weird people yelling at a couple of Nick Cage movies as they're playing. And,
did you wear costumes?
It just made me think about like, yes, we wore costumes. Shay wore the Nick Cage vampire era outfit, and I maybe we post some pictures or something like that. I wore this kind of like, they said dress as a Nick Cage cultist, so I just wore this all black robe type thing, and I didn't know what it was, but some people were like, "Oh, I see it. I see it." I was like, "Okay, I don't know what you're seeing," but thank you.
Just shades.
But
Yeah.
you were just in you were just in Nashville. There's the Tomato Art Festival down there. That was another goofy thing they do every year, where like Nashville is not known for growing tomatoes or anything like that, but they happen to have the biggest tomato art fest of all the land in all the world, and like it's just a bunch of silly people getting together with tomato paintings and photography and music and stuff like that, and like tomato costume contests. I actually used to go every year in Nashville to that, and I just want to encourage the fam to find that goofy stuff that happens locally and get involved in some of that. It's a fun way to meet other weirdos if you're a weirdo yourself.
How do you find weird things, Chris?
By looking around, by, like, while you're walking, keep your eyes open, because sometimes it'll just be like your favorite coffee shop might have a flyer hanging up, and you're like, what? That's next week. Okay, let's get like just be open to it. There's going to be some strange stuff advertised, like a Nick Cage festival. We had no idea what that was going to be, like what we're getting into. But you keep your eyes open to various things, and it keeps the mind expanded and just keeps you having fun.
I love that you gave those tips. I think it is a nice segue with the bucket list items. So maybe I need a new bucket list item, which is find something weird and go do it. I'm not usually
I want to know.
I'm not usually up on the weird, but I might be for you, Chris.
If you're in Nashville in August, then we're gonna have to visit the Tomato Art Fest, and maybe do you think there's some art community type stuff happening in Connecticut?
There definitely are. Connecticut loves to do like historic-y things. The town I grew up in, it's like 5 miles from where I live now, but they do a ton of like historical reenactment. So you could have like historical fest and, all interesting things. You could totally dress up as a colonist if that floated your boat. So, a historical art show, totally, all the things.
You just told me that where you live is big on historical reenactments. I want to go and see what on earth is going on, especially with that region. Yeah,
Oh,
that sounds cool.
Come visit. You could have joined Fife and Drum as a kid and marched down the street if that really was exciting for you.
And one easier one to find is Renaissance fairs. You always meet cool people at Renaissance fairs.
My other favorite show, The Love on the Spectrum, they love to go to that Renaissance fairs. I've not been, but sounds amazing.
Keep an eye on it. Like if y'all are at a historical reenactment like hub, oh my gosh, I bet it's really good. I bet y'all have some really good ones over there.
Alyssa knows. She knows what I'm talking about. She can find some as well. Yeah. We grew up in the same hometown, so
awesome.
We know. Amazing.
Well, y'all, thanks for sticking around with us. We look forward to again, we're it's warm takes at most, nothing too hot, but like we try to get you the information and back it up and celebrate the experts behind it.
Yeah, I love that. And just leave you with some tips that help you to build whatever life you're dreaming of, whether you're in it to win it or trying to find something new to win. We are behind you.
Oh, and be like Jessica, help other people find that as well by sharing our stuff with your clients, friends, grandmother, etc.
Be like Jessica. I love that.
Yes. Thank y'all so much.